Hello, my name is Thomas Burnaby, and this is my week 5 video. I have completed 150 questions on Kaplan and my 30 questions of the U World, and I have reviewed all the missed questions. So, the questions that I'll be reviewing currently will be the first question is: a client has been diagnosed with atrial fibrillation. The healthcare provider prescribes warfarin to be taken on a daily basis. The nurse instructs the client to avoid using which over-the-counter medication while taking warfarin. So I selected, I couldn't see all the answer choices, but the one that I selected was diphenhydramine because I was thinking diphenhydramine's common side effects is drowsiness, so it could have affected how a patient will react with warfarin, but the correct answer was aspirin because aspirin is an antiplatelet medication, and the use of aspirin is contraindicated while taking warfarin because it will, because of the potential drugs side effects, and the combination of aspirin and warfarin can result in a significant increased risk of bleeding and hospitalization. The next question is: a new grad nurse is providing discharge instructions to a client with stable angina who has prescribed sublingual nitroglycerin. Which statement by the new nurse will cause the precepting nurse to intervene? And the answer choices are: call emergency medical services if symptoms persist after 3 days. Nitroglycerin can be taken prophylactically before stressful activities. Sit or lie down when taking a tablet of sublingual nitroglycerin. Or lastly, tablets should cause a tingling sensation under the tongue. So I chose nitroglycerin can be taken prophylactically before stressful activities. I didn't think that it could be taken prophylactically. It was mostly of a when you have angina, you should take it. But the correct answer is call. Also, for the correct answer is call emergency medical services if symptoms persist after 3 doses. I thought that was correct because you, if the patient has already history of angina and they have it occurs again, you want to wait until 3 doses, but that is incorrect actually. The client should, well, once they're experiencing myocardial ischemia, they should take the first dose of nitroglycerin and call the emergency medical services once, if the pain isn't relieved before taking the second dose. So that's usually 5 minutes. Therefore, option one, waiting until the third dose to call EMS delays life-saving interventions. And nitroglycerin may be taken prophylactically before events known to cause angina, such as stressful situation, lawn mowing, or sexual intercourse. My last question is: a client with methyl-resistant Staphylococcus aureus, or MRSA, bacterium has been receiving IV vancomycin for the last 3 days. Which blood test trend is most important for the nurse to review when preparing to administer this medication? The answer choices are blood cultures, creatinine levels, magnesium levels, or white blood count. I believed and I chose white blood counts because we're looking at MRSA on a patient, we should be concentrating on how the levels, or to see if vancomycin is working. Therefore, you should look at the white blood count. However, the answer choice is creatinine levels, because vancomycin can cause nephrotoxicity, which often occurs in clients who have some sort of renal impairment. Creatinine levels should be monitored daily to look for an increased level over a few days. If there is an increase, then we should consult the healthcare provider and or pharmacist before administering. and then the blood count, white blood count may be helpful in determining the effects of vancomycin therapy in treating infection. However, this laboratory result is unlikely to influence the nurse's decision on whether to administer the dose. And this concludes my weekly video. Thank you.